The achievement of a functional and efficient national health insurance system will require the digitization of healthcare data through a centralized electronic health record system. However, cybersecurity experts warn that this shift exposes sensitive medical data to potential cyber threats. They stress the importance of a zero-trust security approach to safeguard patient information. With only 40% of healthcare professionals currently using digital records, training and cybersecurity measures will be crucial for protecting the NHI's infrastructure. Enterprise Security Solutions lead at ESET Southern Africa, Calin Cloete, joins us for more. A very good evening to you. Thank you so much for your time. I mean, the NHI is a crucial step towards a modern, digitized healthcare system, but of course it comes with its national scale cyber security challenges. What is at stake?
Good evening, Paul, and thank you so much for having me today. So there's quite a lot at stake when it comes to cybersecurity. So the NHI, the health systems, the electronic records, seems to be the cornerstone of what the objective is with cybersecurity for digitizing the systems. But the challenges arise when, there's sensitive data that comes into play. So organizations often find it very challenging to, keep clients' and patients' information safe.
And the cybersecurity needs to be embedded. I know that a lot of comment has come around this, that it needs to be embedded into the NHI's electronic health record and not treated as an afterthought. Why is that so important?
100%. That is absolutely correct. Like we always stress, it should be embedded from the onset. So when it is in planning stages for these sort of applications that are designed, it should be embedded in the planning stages and not treated as an afterthought. The reason for that is because security is imperative in our daily lives. We find that security is, crucial to many organizations. That is because of data breaches that is on the constant rise. So that is why it is very important to not treat it as an afterthought, but make sure it is embedded from the onset.
And what will happen if it's not carefully considered? Should government fail to put a lot of consideration around this, what would happen?
So it impacts things like, business continuity. We've all recently seen what had happened with various government departments and institutions that has come across, cybersecurity breaches. So there's a lot at stake, things like reputational damage. So those there's key stakeholders that are going to have to answer and make sure that they, are responsible for what happens when there's a cybersecurity breach. So reputational damage, business continuity. There's also things like data integrity. If you don't have the adequate measures in place, that is a lot of things that can happen or go wrong when you don't have the measures in place.
So what we've come to discover is that only 40% of healthcare professionals are currently using digital records, which reflects on the much needed training, right? What kind of training and cybersecurity measures will be needed to protect the NHI's infrastructure?
So, even us as a cybersecurity institution, training and, creating user awareness is constantly at the top of our minds, right? So what we would recommend is that, doing user training, because when it comes to cybersecurity, the weakest link in your, in your entire infrastructure is actually the user, right? So the human aspect, because there's things like phishing, there's also spoofing or whatever the case may be. So training your users is critical. What can happen as well is that you can do simulation, cyber simulation training, where you can do internal training. You can also, of course, ramp up your security, make sure that you have mail security solutions in place. So there's quite a number of things that these organizations can do, but they can reach out to security organizations that would would be able to assist them with, sort of penetration testing applications, and making sure that they have the measures in place from a security perspective.
And what are the lessons that we've learned about the impact of not having these measures in place, especially as we look at such a massive project?
Again, reputational damage is something that comes to mind first, because we've seen that happen. Once the trust is lost, it's really difficult to get that back. We've been in many conversations, very difficult conversations, where it's, rather, we always recommend prevention is indeed better than cure when it comes to security. Have the measures in place beforehand, before you get breached, because, like you said earlier, 40% of healthcare practitioners and professionals, their passion is healthcare and serving people. But it is also important to, adapt with time and make sure that they also trained up and skilled up when it comes to security. So always make sure that you reach out to organizations that are the experts when it comes to cyber, and we are here to help and answer those type of questions that business find critical that they don't have the answers to.
Sensitive medical data to potential cyber threat is one of the exposures that not having a proper security system could have on patients. I mean, how you speak about reputational damage, but in the instance that sensitive medical data is out there, I mean, how much harm can that do for the patients who trust that their information is protected?
So a key word in cybersecurity is exactly that, trust. So trust, it's personal information of people being out there, and it goes against many regulations across the globe. In South Africa, we have the POPI Act. Across the globe, they refer to GDPR. So again, you at breach, but it also causes a lot of damage to patients, having their private and confidential information out there, that also causes a big impact personally.
And as you assess, what's at stake and the impact of having a tight system, how do you think it will then benefit how the entire project is received and how it operates, and how those in the space are able then to ensure that they are really not breaching doctor-patient confidentiality?
Again, it takes us back to the point of training, right? So because, medical practitioners, we don't expect them to be experts when it comes to cybersecurity. Their field of speciality is, in the medical field, but training is of utmost importance, because the human aspect is very easy to, circumvent and bypass. These threat actors essentially look for humans to try to go into the network, right? So a very good practice is, of course, going back to your point in the very beginning, is a zero trust approach. So what a zero trust approach is you don't assume anything. You don't assume that this is a doctor at the hospital, this is a patient. Just in very layman's terms, you need to make sure that they authenticate. So we advocate for things like multi-factor authentication. We also authenticate for things such as, making sure that they have additional factors and training within the organizations. So that is crucial and critical to ensure that each layer, so be that doctors, nurses, patients, each one has the stringent measures in place to ensure that, we don't take anything for granted, we don't trust anything. Everyone has to authenticate.
Very well. Thank you so much for speaking to us this evening and weighing in on this very important discussion.
Thank you so much.
That was Enterprise Security Solutions Lead at ESET Southern Africa, Calin Cloete, speaking to us there of the importance of ensuring that the healthcare data is centralized through an electronic health record system, preventing it from cyber attacks.